Pain in the back of your leg isn't always your Achilles. When we think of the anatomy of the back of the leg, we have our big calf muscle, Achilles tendon, and then we have our sural nerve running down through the outside. This MT stands for musculotendinous junction, AT for Achilles tendon, and SM for sural nerve. Commonly, people will get diagnosed with an Achilles tendinopathy when what's actually aggravating them is this sural nerve in on through the site. And there's a couple of clinical tests we can do to make us believe more likely that sural nerve is involved. So one thing we can do is get people to do low tendon load but high stress into that nerve. So I can ask people to bring your foot back a bit for me, and I'm going to get you to slowly bring your knee into the wall without your heel lifting. And you see, think of that like a piece of string. This sural nerve, it runs down in through here, it pops out from deep to superficial at the level of the MT, and comes down in through the outside. So thinking of it like a piece of string, essentially what I'm doing is pulling on it, putting some tensile stress in through there. Now that may bring on some symptoms, some burning, numbness or tingling in through there, or some distal symptoms down in through the foot. All right, come back up for me. The other thing is, because it is quite superficial, if I find the tendon, I should be able to come on the inside in through there, and if I'm pushing in through there and I'm right in underneath that tendon and they're getting some symptoms, it could be numbness, burning, tingling at the area or distal, that may make me think it is more likely to be that sural nerve. Now the other thing I'll get people to do is when they're laying on a bed, I'll get them to hang their feet off, and I'm going to show the position here standing. So I'll get them to maximally planter-flex, which means come up on their toes, keep your toes in contact with the ground for me, and I'll get them to invert and roll their foot in. So if you imagine legs hanging off the bed, there's not any weight in through there, it's a neural tension test, and just like we did with the needle wall test, we're going to be putting some tension in through there. So that's really low tendon load, it's really low muscle load. So if someone's getting some symptoms in through this area or down in through the foot, it's making me think potentially that sural nerve is more involved. Because it sits in this area, it's going to be right close to the skin. So superficial means it's closer to the outside of the skin. So if I start to percuss down through the outside, and again, I'll do this when someone's laying on their tummy, I may be able to bring on some neurological symptoms. Now I'll do it for at least 15 seconds and seeing and asking, do you get any symptoms that correlate, very importantly, they need to correlate with the symptoms that we're getting when we're out, running or doing the things that we usually do. Because if I do this on the other side and the symptoms are the same and it's like, oh, it doesn't really feel like that, I get that more discomfort here, well, it might be more likely to be the tendon, and it may just be that someone is more sensitive in through there, because if you do that for long enough, it's likely that someone's going to get some sensitivity. So this helps us understand potentially all the contributing factors. I cannot stress this enough. This is not medical advice. You need to go and see a health professional. This is to show and understand the anatomy, what can be a potential differential to that Achilles tendinopathy, which is an incredibly common condition in runners. Now, of course, you can have AT and you can also have some sural nerve involvement because they run so close together. And we do have some research to suggest if you have some AT or a thickened tendon, you may be getting some compression and irritation into that sural nerve.